Today, we're going to focus on a number of objectives. The first is to address the unmet clinical need of recognizing obesity as a prevalent disease that can lead to cardiovascular disease risk factors. Let's start with our first question, which is, how do you define obesity? How do you explain obesity to your patients?
So I think when I define obesity for other healthcare professionals, for my peers, I try to talk about it as a neuroendocrine disease that's really just a dysregulation of the body's energy regulation system. And I love the quote from Dr. Lee Kaplan from Harvard that overeating doesn't cause obesity, obesity causes overeating. I think it makes everybody stop and really think about that neuroendocrine piece to the pathophysiology.
We talk about what's called excess adiposity, or where that fat is located, because maybe you may not look as a typical person that may be suffering from obesity, but where your particular adipose tissue is located is an inflammatory condition.
A lot of people think of adipose or fat cells as just another cell in the body, but as we know, they have hormonal and cytokines that are sent out when they become dysfunctional. And so when we see that excess weight or excess fat being deposited or being stored in these cells, they actually turn from just storage houses, the way I explain it to patients, to actually active centers that are sending out inflammatory markers and cytokines that are affecting so many parts of the body.
I always characterize the fat cell as this organ, this dynamic organ that is the central of so many diseases. There's almost no disease or state of being that it doesn't impact, from asthma, to skin conditions. And so it's that common thread that it's a way to impact disease by addressing kind of what we call the core defect of human health.